So having had a new wave of newly qualified optometrists join the fold, congratulations to all those of you that passed your January OSCEs. I wanted to talk about what happens after the scheme of registration. So our learning doesn't stop. Optometry is a subject that's constantly evolving and developing, and there have been so many advances in technology and our knowledge in the past few years. So how do we keep up with this? We used to do CET, which the GOC have now changed to CPD from this year. And one of the websites that I use is Docket. And on there, I listen to Sound Optometry, which is a podcast bringing you quality CPD content wherever you are. You can listen to it on your phone, on the go, and it's really, really great. And I use it in my car on the journey to work every day. And today I've got someone really special talking to me. She's a qualified IP optometrist with many years in practice, and she's the voice in Sound Optometry. Thank you, Michelle Hanratty, for joining me today.
Thank you for having me.
So can you tell me, what did you do before this and how did you get into doing Sound Optometry?
Well, I've been qualified for quite a long time. So I started off as a Boots pre-reg, like probably many of your listeners. And I worked with Boots for a few years, and I very quickly became aware that I wanted to do more than just work in a consulting room. So I branched out into sort of teaching quite early on, started off at Aston University teaching on their undergraduate programme in their labs. So if anyone who's ever been through Aston remembers their 109 labs, we learned about further diagnostic techniques like visual fields, tonometry. I was doing that for a couple of years. And also became involved in training pre-regs, had my own pre-reg, became an examiner for the college quite early on as well. And it's kind of evolved from there really. But as far as practicing is concerned, from an optometry point of view, I stayed with Boots for a few years, then I moved into the field of refractive surgery and eventually ended up working in a private hospital that is purely dedicated to cataract and refractive surgery, which is where I still am. So that's my day job, if you like. And then because I am also involved in the training of optometrists across quite a wide spectrum, that's how I came to be involved with Docket really.
Okay, and how did it come about to do a podcast? Because it's all, just sound only. There's no lecture as such. So how do you choose the sorts of topics that you want to cover that you don't have to have visual things to go with?
Well, Docket has a very clear remit to deliver continuing professional, what was education, but now development to practicing optometrists, qualified optometrists. And that means that you've got to reach out to those busy optometrists. So they haven't always got time to sit down and do a whole course module in the detail that we currently have on our website. And webinars, although they have increasingly become more available in the last couple of years, 2 or 3 years ago when we were thinking about what else offering Docket could provide, it wasn't obvious at the time what else there could be. So there was an audio program called Advances in Eye Care, which started out, as many people may remember, as a recording on CD that was sent out to practitioners, and that eventually was converted into a podcast. But it was felt that it didn't deliver information to enough people. Not enough people were listening to that. And that's when we came up with a new concept of a podcast, a defined podcast that was going to target everyday issues in optometry practice, rather than just the advances in eye care, which is what the previous audio offering was about.
It's actually really good because I use it on my journey to work. And I think there's been some times where I've listened to a couple of them a few times over, because I find that with listening to it on a repeat or listening to it again, even if it's after a couple of weeks or so, you pick up different elements throughout. And the way the podcast works, it's a great sort of timing as well. It's not a full hour or hour and a half that you're sitting there in front of your computer listening. You can do it on the journey. So my journey to work is 25 minutes, and most of these podcasts are about 26, 27 minutes. So it's perfect. I can park up and I have plenty of time to finish everything off. So what are the sorts of CET CPDs that are available on Sound Optometry? Is it based on certain competencies that we need to cover? Does it cover everything?
Well, we don't have a very fixed agenda going forward, and it does tend to try and be responsive because it is a monthly production. So we can't be responsive to whatever's happening or what we feel is current at the time. So in that way, it can respond to the current needs. So for example, when during the pandemic, there was an increased interest in infection control, for example. Although infection control infection control was covered earlier on by other providers, we felt that when we were coming back into the autumn of the autumn season, where common colds were going to be more frequent and COVID hadn't quite gone away, we felt it was quite good to actually readdress the importance of not being complacent about infection control. So we were able to then do a podcast around infection control, which met with the current climate, so that was appropriate for the current climate. So I do feel that's an advantage of having the monthly podcast. But we generally have a discussion group. DOCET has an executive meeting every quarter, and we discuss from people from different parts of the country, give us ideas as to what they think would be suitable topics. And so we then go away and research the viability of those topics and produce those topics, and that then forms the basis of our podcast.
And more recently, the change has happened from CET and CPD. So for those of us new to the fold, especially our newly qualified optometrists, what does that actually mean, and what are they supposed to do with that?
Well, before, CET was very rigid. So you had core competencies and you had to have your CET points spread across those core competencies. And so you had to have, for example, to have covered, for example, dispensing, or you had to have covered low vision. So it was very rigid in what you had to do, whereas CPD has 4 main domains rather than the core competencies, and those domains are quite wide-reaching. And so instead of trying to hone everything into sort of very defined clinical pockets of practice, the CPD, the domain framework, is much broader, and so it includes the competencies such as communication, but gives you a wider area over which you can seek that development. So, for example, you can get some of your CPD points, if you like, from specific accredited CPD courses or providers, but you can also go away and find your own area of interest that is relevant to optometry and form your own CPD, sort of your own development plan, and then go away and work on that and have that as part of your overall CPD portfolio, which will then you'll be able to submit to the GOC at the end of the 3 years. So an example of that might be, well, I'm interested in, for example, say cataract surgery, and it might be that you've read some articles within the optometric journals such as Optometry Today or Optician about cataract. You might want to take it one step further, and you might want to listen to a recording or a webinar, but you also might want to go away and look at some of the references that were indicated on those articles. So you could go away and look at references, and they might be, for example, in a journal of ophthalmology, cataract and refractive surgery, for example. And those articles themselves, by reading them, they're not actually CPD accredited, but actually you're still learning something from those. And if you actually do an hour of learning, you can then apply that to your CPD portfolio, as long as you explain how you've used that and how it contributes towards your CPD, and it is actually still valid. So I think the scope is broader, and you can tailor it to your own needs as well and to your area of interest. So from that point of view, I think CPD has the benefit of being more suited to each individual, rather than feel like you're having to, rather than a tick box exercise, which is what it was becoming before.
And what would you say is the most interesting topic that you've covered while you've been doing Sound Optometry?
That's a difficult one. As far as personal interest is concerned, I'm always interested to hear about anything that's to do with pathology. But I always like it when I learn something that's completely new or I didn't know about it. So I thought the subject of the webinar that we did on lesions recently was really, really interesting, and because it was on anterior eye lesions, and not the ones on the lids or the lashes. That area wasn't on the retina. It was that bit in between, and I hadn't really covered that in any detail before, so I thought that was really, really fascinating, because it felt as if a lot of it was quite new to me.
So when you do things like this, where you're trying to explain some kind of pathology or some kind of problem that you should ideally be able to see on the eye, how do you then describe it? Or are there any additional resources that are on that attached CPD course that someone can look at?
Yeah, so from my point of view as presenters, I have the easy job of actually just asking questions. So I think as an optometrist, what would I want to know if I was in practice? And that forms the basis of all the interviews that we do. Is, if I was in practice, if I was in that story, what would I want to know? And then I get to ask the expert. So I get the easy part. I get to ask the questions. The expert then has to answer those questions, which is a little bit trickier. And sometimes it's hard to limit yourself to just that 25 minutes. But then quite often what we do afterwards is we speak to the person that's been interviewed and ask them for, if they were to signpost any extra resources, they can sometimes signpost to certain websites or articles, then we ask for that information as well. And also I do quite a lot of research online to find other resources. So as part of the CPD that is now available with Sound Optometry, we have half an hour, or up to half an hour, which is the podcast. And then the remaining hour of learning is around recommended reading and answering some multiple choice questions. And that completes the hour of CPD.
It's really, really interesting to know that, you can go from being in day-to-day practice. You've done what a lot of my students do, work in a multiple, and then you've gone to progress into something else. And then you've come into something that's completely different to what we would normally see in our day-to-day normal high street source of practice. So in terms of advice for those people that are now coming into the profession as newly qualified, what sort of advice do you have about the career options that they might have?
I think the first thing to do is to get a really good clinical grounding. So, because your OSCEs is only the beginning of your career, although you've achieved a great deal so far, it's really getting that really wide experience that your first few years in practice really give you. If you specialise too early, you can become too focused on one area. So I think that the years that I spent at Boots, seeing all kinds of patients under lots of different circumstances, meeting lots of people, that really honed my skills, and also hones your communication skills because you're dealing with such a broad spectrum of people. So I think that's really important, to get that really good grounding across general optometry first, and then find one area that really interests you. Now, I always really liked contact lens work to begin with, and so I thought that was going to be my speciality. And I think it's because I could see it easily. I could see the front of the eye easily. I always find the fundus a bit of a mystery. So I always liked the anterior eye. And so that's why I decided to go into then refractive surgery, because it's a new and emerging field. So find something that interests you, find something that you want to know more about, and then go for that. But my advice would be not to specialise too early. Make sure you get that good grounding and get your core skills. And then variety is really important in your day-to-day job. So for some people, they want to stay in the consulting room seeing eye examinations, and that might be what they want to do. But quite a lot of people like variety. So if you want variety, you have to go looking for it. So whether that be being involved in different types of consultations, whether it be things like MECs or Qs, being involved in those kind of programs. And if you want to know more about glaucoma, go and do the extra courses, find some extra modules to do, and get involved in glaucoma services. So there's so much out there now that you can get involved in, that I think it's a really good time to be part of the profession. So, and that's the thing, advice that I would say really, is to keep it varied and to keep it interesting. And always remember that what you do helps patients, because ultimately when you do have that situation where a patient comes back to you and says, oh, you know what, I was really pleased that it could be something, for example, you sorted out this really fantastic pair of spectacles where I can now feel comfortable wearing all the time, or I can go out or I can swim in the swimming pool for the first time without having to worry about my glasses and not being able to see my kids, or whether it be you discovered a tumour. The first time you really make a difference to someone's life, it makes all the work worthwhile. And so that would be my advice really, is to keep it varied, keep it interesting.
Thank you. And just finally, to end up our conversation, how does someone sign up to DOCET? How do they get registered? Is it just qualified optometrists that can log in, or can students listen in as well?
Okay, so for the actual DOCET website at the moment, when you go onto the website, you do need to log in, and you're only able to log in officially using your GOC number, and you have to be a registered optometrist to actually access the courses. However, if you don't log in, you can still access the library section of the website, which is the archive material. So it's not active CPD, where it's currently accredited. It's the stuff that's been archived. But pre-regs do have access to the library area, and we have gone through a process of reviewing the library content. So there's not as there normally is, but it will be increasing over the next month or two. As for Sound Optometry, yes, it is available on other platforms as well. So because it's a podcast, it's available on podcast platforms such as Google Podcasts or Apple Podcasts. So you can access it without registering or being a qualified practitioner, but you won't be able to access the CPD materials. That's the only thing.
That's really, really helpful to know. So what's the next topic you're going to be covering?
Well, next month, we've just covered binocular vision, as you know, and next month we're going to be looking at enhanced optometric pathways in England and Wales, because we felt it was quite a nice way of getting people to learn more about what's going on around the country in their profession, what their peers are doing, and also it might give you a sneak preview of what might be happening in your area soon. So things are progressing at different rates around the UK, so it's just to try and increase everyone's awareness of what is possible in the field of optometry.
Thank you. Thank you very much for your time and for joining me today.
Thank you very much for having me.